Now we're going to begin with our massage. So you're going to take your massage product from your palette and you're going to place it at the back of your hand. And you're going to take a little more than half of your product. You're going to place it in the palm of your hand and you're going to begin by warming that product up. The warmth of your hands will help to emulsify that product and make it more fluidy. Once you're ready, your proper stance would be to separate your feet so that your feet are in line with your shoulders. Placing one hand on the band, one hand is going to come down to the chest and it's going to begin a figure 8 movement. Your second hand will now follow. Use your knees if you need to move back and forth rather than your back. From here, you're going to travel around the shoulders 3 times. And then, like your cleansing, you're going to begin with 10 strokes up the neck. When you finish that, you're going to scoop up the rest of your product. You're going to warm that in your hands, and now we're going to spread our product over the face. We're going to start with 3 strokes across the mandible and the chin, and then the chin and upper lip, and then the upper cheeks. We're going to come under the eyes. We're going to stroke across the forehead, pivot at the temples, travel down, and end at the tips of the shoulders. Without losing contact from here, we are going to begin at the center of the décolleté with your fingertips facing one another. Apply medium pressure with palms nice and flat. Come around the deltoid muscle at the top of the arms, over the trapezius and up the back of the neck. Always return one hand and the other so you're never losing contact. Across the décolleté, around the shoulders, and up the back of the neck. This movement is an effleurage, which is your initial contact with the client, which helps to spread the product, warm the tissue, and prepare the skin for the remainder of the massage. Your second movement involves small circular movements with the pads of the fingers over the décolleté or your pectoral muscles, around the shoulders, and then glide over the shoulders up the back of the neck. For your third movement, you're going to slide one hand to the temples. With the other hand, you're going to cup the mandible with your thumb and your index finger in line with the right side of the upper lip. And you're going to travel towards the left side, keeping that mandible bone cupped. When you reach the earlobe, you're going to tuck your fingers underneath, slide down the sternocleidomastoid and off the trapezius. That hand will come to the right temple, and now the left hand will perform the same movement, traveling in the opposite direction. Our fourth movement is where you're going to take that little divot in your thumb and you're going to line it up with the mandible bone. So your thumbs are forming the number of 11 in line with the corners of the mouth. You're going to travel out along the mandible. Open your hands as you reach the corners of the ear. You're going to travel down the sternocleidomastoid. You're going to pass the clavicle bone on both sides and then travel in towards the sternum. And this whole movement is performed with what we call this drumstick area in through here. From here, we're going to end at the sternum. One hand will return to the temple while the other hand remains flat over the pectoral muscles. We're going to travel out around the shoulders, and we're going to perform 3 deep circular movements, working our way in towards the base of the neck and up to the base of the occipital. This hand will return to the temple, and your opposite hand will travel across the chest. 3 circular movements over the trapezius, ending at the base of the occipital. And continue to alternate. From here, you're going to do thumb pushes alternately from the tips of the shoulders into the base of the occipital with your thumbs. So all of your pressure is behind the shoulders. Your fingers in front are just gliding gently across the skin. So your first movement is alternately, and then movement number 7 is simultaneously. So now you're going to work both hands at the same time, pushing in with your thumb, feeling those knots behind the shoulders, and trying to iron them out. From here, we're going to go into a kneading of the chest. So using your second phalange of both hands, starting at the sternum, you're going to knead the pectoral muscles. You're going to work over and around the deltoids, onto the trapezius, ending at the base of the neck. You want this movement to be nice and deep and slow, and you want your fingers to be working simultaneously. From here, we're going to slide into our 9th movement, which is placing our fingers over the shoulders, and we're going to perform 3 circular movements, nice and full around the shoulders. After the 3rd one, you're going to push the shoulders down towards the feet and hold for 3. Then you're going to slide forward, and through the count of 3, you're going to draw those shoulders back into the bed. And repeat. 1, 2, 3, and push down for 1, 2, 3, slide forward and draw the shoulders back. 2, 3. From here, we're going to end our neck, shoulder, and décolleté movement with our 10 strokes. Keeping your hands nice and flat, starting at the décolleté, you're going to end here. From here, we'll transition into our facial massage movements. You're going to slide your hands underneath the chin, travel up over the cheeks without touching the eyes, complete the forehead. You can interlock your thumbs here, glide one hand back down, the other hand over the other, travel out to the temples, pivot, travel down, and repeat. So cup at the chin, travel out and up, slide one hand over, across the forehead, pivot at the temples, and return. So now this is your effleurage movement of the face. From here, you're going to finish at the temples, and you're going to slide one hand across and begin your forehead strokes. So working from the brow right up to the hairline, using a bit of a rocking movement with your wrists, you're going to glide that tissue upward. From here, we're going to go into our forehead circles, so returning back to the center of the forehead. You're going to perform large circular movements over the forehead, nice and slow and deep. When you reach the temples, you're going to slide in underneath the eyes, up the bridge of the nose, and repeat. The movements of the forehead and the eyes are excellent for those that suffer from tension headaches, that strain their eyes on a computer all day, and those with sinus congestion. From here, we're going to transition right into our fourth maneuver, which is eye circles. So as you complete your forehead circles, you're just going to continue with your circling around the eyes. And you want to be close enough to the eyes that you're feeling the tips of their lashes. From here, you're going to go into a brow squeeze. As you come up, use the middle finger and the thumbs, and now you're going to squeeze the orbicularis oculi, which is the muscle that encircles the eyes, towards the tips of the brows. From here, we're going to transition into our crow's feet stroking. With your crow's feet stroking, you're going to use the index and the middle finger of one hand. You need to flex the wrist so that it cups the eye, and this whole portion lies flat. You're going to travel out across the upper lid, the lower lid, and over the crow's feet. And then with the middle and ring finger of your opposite hand, you're going to stroke up over the temples. So it's across and up. To transition over to the other eye, you're going to finish with an outward stroke. While your opposite hand is free, you'll transition over and repeat the same movement on the opposite eye. From here, we'll transition to step number 7, which is eye drainage. So you're going to slide your middle finger down the bridge of the nose, And you're going to perform very small, tight circles underneath the eyes where a lot of water retention sits. You'll return back up over the brows, down the bridge of the nose, and repeat. And you want to pump that stagnant fluid to the lymph nodes sitting in the temples. From here, we'll slide into movement number 8, which is your face drainage, placing your thumbs in the center of the brow and your fingers touching one another. You're going to perform gentle strokes underneath the eyes to the temples. Then return your hands flat over the cheeks and travel out towards the ears. Complete your movements right to the hairline. Then remove your thumbs, placing your hands flat over the cheeks and placing that first phalange of your fingers underneath the mandible. You're going to cup the skin and travel out towards the earlobe and return and repeat face drainage. From here, step 9 is keeping your fingers underneath the mandible with your thumbs. You're going to work across the chin, alternating your thumbs. From here, you'll transition into step 10, which is circular movements down over the mentalis muscle at the tip of the chin, followed by circular movements by the corners of the lips, and then you'll perform 3 circular movements around the nose, and then you're going to hug your fingertips underneath that zygomatic bone and travel out to the temples, and slide down and repeat. Down, 2, 3, corners of the lips, 2, 3, around the nose, 2, 3, and glide. Transitioning into step 11, it's quite similar except we're traveling up over the mentalis muscle. So your circles now are traveling upward and then up over the corners of the lips. And now with your palms flat, you're going to perform large circular movements over the masseter muscles and travel out. And we'll repeat that again. Here we'll transition into step 12, which is kneading of the cheeks. So keeping your second phalange of both hands in contact with the skin, you're going to perform kneading just above the mandible bone towards the earlobe, and then you'll return in between the corners of the lips and the nose, and you'll perform kneading just below the zygomatic bone out towards the ears. From here we'll go into step 13, which is Dr. Jaquette. This movement is performed very quickly, and it's using your middle and thumbs to grip the skin. And it's not poking them, so you shouldn't be head on. Your hand should be on an angle so that it feels a little more gentle. And it's a very quick, stimulating movement. It can help expel excess sebum from the skin. For those that have an oily skin, it can also help to stimulate the sebaceous secretions on those with a dry skin. And it can help tonify the muscles for those with a more mature, slackened skin. From here, we'll move into step number 14, which is the lips. So you need to bring your Dr. Jacquettes or end your Dr. Jacquettes down by the chin. And now using the the index and middle finger, you're going to perform circular movements around the lips. From here, we'll transition into step 15, which is small cheek circles. So sitting just above the mandible, you're going to perform small circular movements. This is very similar to your cleansing, one of your cleansing steps. Then work from the corners of the lips to the middle of the ear, and then the corners of the nose below the cheekbone to the top of the ear. Now we'll transition into step 16, which is temple circles. And that transitioning should be very nicely performed because you're ending at the temples with step 15 with your cheek circles. Just going to perform nice, slow, deep circles over the temples. From here, you're going to go into cheek fanning. To achieve your cheek fanning, you're going to place both palms at the mandible, and you're going to glide in with each finger, bringing your index finger into your palm, and your other fingers will follow. So it's 1, 2, 3, 4. 1, 2, 3, 4. And as you learn this movement, you'll be able to get it up to this pace. So your thumbs are not involved. You can't rest your thumbs on the client's face. And I'll slow it down again so you can see the movement. So it's bringing your index into the palm, and your other ones will follow. From here, we're going to go into face drainage, which is the same as number 8. Placing your thumbs in the center of the forehead, fingers touching, slide under the eyes, fingers flat over the cheeks. Remove your thumbs, cup the mandible, and travel out. So we end the massage the same way we began it, and that's with some effleurage movements. From here, we're going to go into the same movement we started the face with, which was cupping under the chin, traveling up the face, complete the forehead, come across the forehead, pivot at the temples, and back down. From here, we're then going to slide down over the décolleté, come across the chest, around, and back up, which is the same as our very first movement for our neck, chest, and décolleté massage. And to end, you can come across, around the shoulders, and just press down and slide off.